Back pain is one of the most frequent patient complaints to doctors. In fact, recent stats from Georgetown University show 16 million adults have persistent or chronic back pain.
Treatment options obviously vary, but it doesn't always mean that surgery is the answer.
That's right. Now, with us this morning to explore some natural alternatives is Dr. Saul Kogan from our sponsor, the Nerve&Disc Institute. Dr. Kogan, thank you for being with us.
Thanks for having me.
Listen, we were sharing stories with you about some of our own personal knowledge of people who have had back issues. But first, you have your own personal story that inspired you to help others with back pain, and it goes back to your high school days?
Yeah, it's crazy. I really believe everything happens for a reason, and you learn from everything. So I'm here with you today as a result of something that happened to me over 40 years ago. It's hard to say that, but I was a high school wrestler. I was thrown on my back. I felt lightning bolts go down both legs. I was literally paralyzed for over a minute. When I could move, obviously, I was in such excruciating pain I couldn't continue. After that, I went to 11 of the area's best doctors, best surgeons and everyone, and they all agreed on one thing, is that I wasn't going to be able to wrestle in the freestyle state championships that were coming up in a couple of weeks. Well, you can guess why I went to 11. I wanted someone to tell me what I wanted to hear. So I went to a 12th guy that I knew took care of professional Olympic athletes and used high technology in different ways. And he looked at me and looked at everything, and he looked me straight in the eye and said, "I'll have you ready in 2 weeks." 2 weeks, I was a 112-pound freestyle state champion. So, you know, and I don't tell you that to impress you about my wrestling skill.
We're impressed.
But it's but really to
amazing.
To impress upon you that just because someone tells you you have to live with something, they may not be right.
Yeah.
And as a result of that, I was so inspired. I built a large practice and had the privilege of working with the Lions for 14 years and now the Tigers for the past 10 or 11. And I learned that professional athletes get much better health care than regular people. And it's really, there's two parts to it. One is the technology they use. They use the newest and the best. And two is they never treat the symptoms, they treat the problem.
Wow.
And that's just what everybody wants to do, honestly.
Yeah. And that goes to show maybe a second opinion, or in your case, a 12th opinion.
Yeah, you're right.
Very good to have.
Yeah.
I mean, just get that feedback. Now, we mentioned earlier that there's some stats when it comes to back pain, but can you walk us through like how big of a problem is back pain? Obviously, you had a traumatic experience, but for most people, it's just age.
It's like an epidemic.
Yeah.
I mean, it really is. I mean, if you think about it, it's the #1 cause of visit to doctors. Over 83 million work days are lost a year. 200 million days are spent in bed by adults, and it often leads to depression in over 70% of people. So it's a big, big problem.
Because you can't live your life. You can't go for a walk. You can't jump up and do the things you like to do.
Yeah.
Yeah, I mean, listen, I felt my patients' pain. I mean, I know their pain. And that's why I was so passionate of figuring out a way not just to feel better, but to fix it.
Right, but let's talk about this. What are some common back pain myths when it comes to treatment?
Well, here's the thing, is most people believe if they have a back pain or a neck pain or sciatica, they think they have one problem, their pain. When actually they really have two problems. One, the pain, and two, the bad disc that's causing it. See, if you have a disc problem, usually it's degenerative and then bulges like that. And you can take medicine, make it feel better, or you get some therapy and get some inflammation out, but without bringing that disc material back and repairing the disc, the problem comes back, often leading to surgery. And that's why I believe this is becoming an epidemic.
So what is the unique treatment that you offer?
So we do something called intra-disc neutrosis. It's the only non-surgical, non-invasive, painless treatment that addresses not only the anatomy of the disc, but the physiology of the disc. So drugs, therapies, epidurals, lasers, those things are designed to treat pain, or maybe some muscle. They don't do anything to repair the disc, and this is crucial because if you don't repair the disc, the problem comes back, ultimately leading to either a lifetime of pain or surgery.
So let's look at some before and after pictures that we have available. Let's look at this.
Yes.
So explain to us what we're looking at.
So the one on the left, if you look at the very bottom, there's a bone, a disc, a bone. That's the biggest herniation I've seen in 32 years of practice. It's absolutely enormous. This lady had 10 out of 10 pain, couldn't walk without a walker, was scheduled for surgery, heard a nightmare about surgery, canceled it a week before, came to see us. The picture on the right is her 12 weeks into treatment, and 3 years later, she's still doing fantastic.
That's amazing.
And this is a person, if I showed that to a group of surgeons 20 years ago, they would have had me escorted by security saying it's impossible. We see this every day.
Now, we have a couple of testimonials, so we want to get to that so your patients can speak for you.
Yes.
Yeah.
I can walk again. I am back to work full time. I can play with my grandkids again. I've gotten my quality of life back.
I'm playing pickleball again. It's so fun. It's such a fun sport, and I'm so happy that I can play again.
So my husband and I were on vacation, and we walked over 20,000 steps, and pain-free, and I never, ever thought I'd be able to do that again.
Wow, clearly life-changing.
It brings a tear to my eye.
It really
It's
does.
like,
Same here.
I have the best job in the world. I get to
really
change
do.
people's lives.
And an amazing story as well. Dr. Kogan, thank you so much for joining us right here on Live in the D, and thanks for helping everyone
My
as well.
pleasure. And by the way, for your listeners, we're doing no-charge consultations through the end of the month and 50% off. So pick up the phone. They can call our office at 586-416-DISC.
Yeah, that if you know someone who is suffering from chronic back pain, you can get more information by visiting Nerve&Disc or you can call 586-416-DISC. And like Dr. Coogan mentioned, viewers who mention WDIV will get 50% off their treatment. Thanks again.
Thank you.